Dr. Sibanda, thank you very much for your time this afternoon. So this mosquito is usually found in India, but has recently made an appearance in Africa and more especially in urban areas. What impact is this having on the numbers of malaria cases?
Well, we have not seen the impact as yet. We still need more evidence. They do what they call mosquito vector surveillance. So they need to surveil the vector and see how it proliferates, particularly in those urban areas. And I think slightly later on, that's when we'll start to see the data on the impact that this new strain of mosquito is having. But it is worrisome because generally malaria is more concentrated in rural areas. So if you have a vector that thrives in urban areas, that becomes a bit of a worry.
Do scientists have any theories on why this mosquito is now found in Africa?
They still need to find out why it's decided to invade Africa, to become an invasive species in Africa at this point in time. So no one fully understands the background as to why this vector is now appearing in urban centers in Africa. It could be anything, it could be climate change, so really studies need to be done to find out why this vector seems to proliferate in urban centers of Africa.
And can you tell us which regions are affected, and should South Africans be worried?
Well, it's still far off mostly Northern Africa. I think in Sudan, in Ethiopia, and it hasn't been discovered yet down south here in South Africa. In South Africa, we have a very strong vector surveillance group, mostly based at the NICD in Johannesburg, and we haven't had any reports that there is a new vector that is coming into South African cities. So I don't think it's something to worry about at the moment. Just we need to be vigilant and follow this new vector that is coming through.
And of course, we have to ever be vigilant against malaria. And if one variant in COVID-19 wasn't enough to cause a lot of worry, fever is also a symptom common to malaria. So could this lead to cases initially being mistaken for COVID-19? And if they're mild at onset and left untreated for too long, could that be problematic?
Well, the symptoms of malaria are distinctly different from COVID. I mean, generally COVID, you have respiratory issues, but malaria is fever, and then you get headaches, and then you get, loss of, loss of energy, you don't feel well, you want to sleep, and the fever is hot and it's cold, so it's very different from COVID. The most important thing really is people should not diagnose themselves. If you're not feeling well, go and see a doctor so that it's quickly isolated and quickly treated. Malaria, one of the reasons why it's got a high death toll in Africa is because people take long to visit health centers and get treated. It's very important when you start feeling symptoms of any disease, especially malaria, to quickly go to the health center and get it treated as soon as possible.
Dr. Sibanda, before I let you go, so have recent increased rainfalls impacted the mosquito population here in South Africa?
We expect the recent rains to increase the habitats that female mosquitoes require to lay their eggs. So we expect the numbers to rise significantly. And really, the awareness message that we want to pass to people, particularly these coming holidays, Easter holidays, when they go to Limpopo, Mpumalanga, and KwaZulu-Natal, and even the rest of Africa, is that we expect to have high populations of mosquitoes. If you're in those areas, most likely those mosquitoes are already infected with malaria. And in addition to prophylaxis, you need to protect yourself by preventing mosquito bites. And one of the most interesting things about mosquitoes that carry malaria is when you're outdoors, they selectively bite on the ankles and feet. Scientists, have not isolated why they do that. They're still studying it, but they choose to bite on the ankles and feet. So it's very important to protect that area with a suitable insect repellent or an insect repellent textile, such as insect repellent hiking sock or an ankle band that can go around the ankles. so that you reduce the probability of being, you reduce the number of mosquito bites, particularly infective mosquito bites, which further reduces the probability of getting infected with malaria.
Well, thank you very much for taking the time to speak to us. That was Dr. Mthokozisi Sibanda. He's the CEO of African Applied Chemical.